Today, we connect with two experts on an issue making headlines. The COVID-19 pandemic has infected over 3 million people so far and taken the lives of 209,000. The United States has been the worst hit so far, with nearly 25,000 people infected every day. Italy and Spain seem to be on a decline, but they are still reporting hundreds of new cases on a daily basis. However, several European nations and a handful of US states are taking steps to ease lockdown restrictions and reopen their economies. So when is the right time to loosen restrictions, and how should it be done? For this, we speak with Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, and Dr. Bruce Wiley, Doctor of Medicine and medical journalist based in New York. My first question to you, Dr. Perlman. Before we lift restrictions, it would make sense to first be sure that they're actually working. So countries like New Zealand this week have claimed to have beaten community infections at least. But on the other hand, we're hearing reports that about 40% of the infected don't really show any symptoms. So at what point can any country say that they've sufficiently flattened the curve?
Well, certainly the asymptomatic transmission makes things more difficult. And I think what you have to do is you have to balance eliminating most cases, so you can see that there's a decline in the number of cases, and recognizing that as long as you go on having everybody locked down, the economics of that country are going to be in peril. So you have to balance these two, and I think one of the most important things is to have testing in place so that you can see which people are getting reinfected or getting infected for the first time, and is this widespread, and is the infection spreading. So that's really a key part of it, knowing where you stand in terms of infections and in who's protected from infection.
So you're saying that testing needs to be carried out, it needs to continue being carried out, and there needs to be tabs on cases of reinfections as well. Oh, Dr. Lee, well, all of these policy decisions, they need to be made in the interest of the people. And do you think that the benefits of easing a lockdown really outweighs the negatives at this point, especially in countries like the US or the UK?
Well, Dr. Perlman is absolutely right, mentioning the costs of maintaining social distancing measures. Certainly, businesses are losing money, and there's a lot of typical work and transactions that can't really occur under social distancing. But we also have to remember the other side of the equation, which are the costs of having the virus spread further. So, for example, recently we just published a study in Health Affairs which showed the direct medical costs associated with greater increases in the percentage of the population infected with the COVID-19 coronavirus. Because there are costs, clinic visits, there's hospitalization costs, there's costs of all the different procedures, and of course there's the impact of deaths as well. So it has to be a balance between the two, and determining when you're determining the right time to ease restrictions.
So it's really quite a difficult equation to work out at this point. Well, Dr. Perlman, are there any countries where looser restrictions are rather appropriate at this point, and on the other hand, countries that may be easing them too quickly?
Well, this is always a difficult question. In the U.S., we have areas where there's very little infection and others where there's much more. So in my state, in the rural areas, there's maybe one case per county. So that would be an area that would be more easy to reduce the lockdown. I think it's so much a balance between wanting to minimize the likelihood of a second wave of more cases occurring. The other thing that I've noticed is, even in my town, that people are not keeping social distance the way they did 2 weeks ago. And so I think that it's really important, though, as we reduce lockdowns, that people realize that we're not out of the woods, that we have to keep all the precautions up. People have to wash their hands vigilantly and wear masks when they're told to. So it's just it's a very slow process, and we have to do it very, very carefully.
Well, Dr. Perlman, actually in South Korea as well, we're planning to somewhat ease social distancing measures next week, and the government is considering allowing children to go back to school. But then we also have over 200 cases of reinfection. So, I mean, is even South Korea safe? Should it proceed with some easing of restrictions?
Yeah, I think it's the same answer. You have to just do it really slowly. If you're seeing a second wave occur, then you have to go back and have make sure that people do appropriate social distancing, and do all the things that we did during this wave and the first wave. And I think that hopefully we're going to be better prepared in terms of testing and knowing what we need to do to protect our healthcare facilities. So all the things that we didn't do that well the first time around, I hope that we will get right the second time around.
Well, Dr. Lee, when do you think is the appropriate time to ease lockdown restrictions? And how do you think that each easing stage should be layered?
Well, one of the most important things is to make sure that there are strategies in place and programs in place first before you then start easing the lockdown. So, one of the big strategies is test, trace, and isolate or quarantine, which basically means you have to have a lot more widespread testing. So, because if you don't test, you don't know where the virus is and who has been infected and who hasn't been infected. And there are two types of testing. One is looking for the active infection, looking for the virus if they have an active infection. And the other is serological tests, which is testing if people have antibodies and they've been exposed to the virus. So you need to get a better sense of that. And test, trace, and isolate basically means you find out who might be infectious, you find out whom they might have contacted all along, so that's called contact tracing, and then you quickly isolate or quarantine all those folks. And that way you can contain the virus before it spreads any further. So only when that is actually in place can you actually reduce the social distancing measures. Because what happens if the virus starts spreading? If you don't have a program in place, then you really can't catch and contain the virus.
So, Dr. Lee, can these easings actually then be reversed quickly if it does create unintended consequences? And do you think the government and the medical community would be better prepared to deal with the possible fallout, especially of a second wave?
Yeah, you can. Speed is of the essence. Time is of the essence. If you see that the virus is actually circulating, you only have a certain amount of time before it simply multiplies. I mean, you're really talking about math. One person can then infect anywhere between 2 to 5 people, and then they in turn can infect 2 to 5 more people, so it can spread exponentially. So you basically have to quickly get people back into the original mode of social distancing, and that's a behavioral issue. Sometimes it might be tough to get people back into where they were. So having those plans in place is very important, and being able to communicate those plans quite rapidly is really important. Have we learned from the initial missteps when it comes to this pandemic? Hopefully some of the programs are in place, and we've gotten a lot further in terms of the tests being available. So the FDA has been encouraging more and more serological tests to be developed and produced, and testing, when it comes to testing for the live virus, is more available than before. But we still have a long ways to go. Certainly within the U.S. The U.S. We've been behind the curve in terms of dealing with this pandemic, and there are proven strategies that work against the pandemic. We just haven't been able to implement those.
Well, Dr. Perlman, what do you think government should do to minimize another surge of infections once these lockdown measures are eased or even lifted?
Well, I would agree with Dr. Lee. I think that you have to have lots of testing in place, and that you have to be able to trace people who are infected. The other thing I think that we learned from this first round is that it's really important that we protect our vulnerable populations. So people in nursing homes. In my state, there's been a huge number of infections in meatpacking plants because people are, first of all, told that they need to work because it's a vital industry, and then the companies that employ them tell them they need to stay at work, and then they're too closely packed together. They're not doing social distancing. So I think that that's another thing we can do, especially the nursing homes where people are really susceptible to being infected and having a poor outcome. And that's been I don't know what the proportion is going to be of those number of people who have gotten sick and died, but it's much more than it should be.
Yes, it's unfortunate that the already vulnerable are the most susceptible to things like a pandemic. Well, Dr. Lee, health authorities are warning that a second wave of infections is on the way. White House Health Advisor Dr. Anthony Fauci said Tuesday that the virus certainly will make a comeback in the US, even as cases begin to stabilize. Should we then continue the lockdown to a certain extent, especially as we head into summer? As we were discussing before, French media have already reported that summer travel packages are being marketed.
Yeah, so one big question is really what's going to happen to the virus in terms of its activity during the summer. There is evidence that we've seen other types of respiratory viruses decrease in their activity as the summer months approach. There's some different theories that have been tested in terms of why is that the case. Like the increasing humidity might play a role in that. But it's not quite clear what will happen with this COVID-19 coronavirus. So it could be that the activity may decrease over the summer, but the concern is that once we move into the fall and the winter months, like many other respiratory viruses, the activity will start to pick up again. And if it is indeed the humidity that's driving the transmission, then as the months get drier and drier, transmission will pick up. So that's the big concern. And as long as the virus is circulating somewhere, then there is the risk that there can be a surge in cases once again.
I think that's a point we all need to remember. As long as the virus is somewhere, it really can spread, and very quickly as we keep finding out. Well, Dr. Perlman, just before we go, for countries that might be loosening their restrictions at a faster pace than they perhaps should, what advice do you have for the people in those places?
Well, they have to pay attention. They have to keep the usual precautions, the same precautions that they were doing while they were locked down. I can't emphasize enough washing your hands and being careful. If you're ill, stay home. If you're around people who are ill, back off from them. We know a lot more about this virus, and one of the main things we know is that's the way it spreads. And a lot of us think that we're really not going to be back to normal for quite a while, several months, maybe substantially over a year. So we have to be cautious because this virus will not go away. There's no reason for it to, and we don't really know enough to know when it's going to come back. But we know we have to do things to try to minimize that possibility.
I see. Well, I'm afraid that's all we have time for today. But thank you very much, Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, and Dr. Bruce Wiley, Doctor of Medicine and medical journalist in New York.
Thank you.
Thank you.
This is also where we end the show today. Thank you for watching. We'll be back on Friday, Korea time. Until then, have a lovely day or evening wherever you are. Goodbye.